Hello, everyone, and welcome to today's edition of Midday Discourse on Global Television. My name is Samuel Odi, and on today's edition, we are going to be looking at your health and your hygiene, basically, because with the recent outbreak of cholera in Nigeria, we all need to pay very close attention to our hygienes. But before we get diving deep into the discussion, I would want to take us back a bit and then bring you up to speed to when the first cholera outbreak happened and where it happened and all of that. So we're just going to get into it. So the disease that we don't know as cholera originated in India, probably in the Ganges Delta. The first cholera pandemic began in 1817, when the disease spread by trade route from India to other countries in Asia, including China and Japan, and to southern Russia, the first country in Africa. Now we are bringing it back to motherland. Yes, the first country in Africa where cholera outbreak started in the year 2024 was Comoros, which confirmed an outbreak on January 31st, 2024, linked to an importation from a passenger on board a boat on board a boat. So in 2021, the highest ever reported cases of cholera were reported in Africa, with more than 137,000 cases and 4,062 deaths in 19 countries. The Nigerian Center for Disease Control and Prevention said the country has recorded that the recent outbreak now that happened in Nigeria. The Nigerian Center for Disease Control and Prevention said the country has recorded 1,528 suspected cases of cholera and 53 deaths in 31 states across 107 local government areas. The Director General of NCDC, Dr. Jide Idris, said this as a press briefing on the updates on the cholera situation in the country. Idris also said the federal government has activated National Emergency Operations Centers for cholera. He said as of June 24, 2024, 1,528 suspected cases and 53 deaths have been recorded across 31 states, across 107 local government areas, and cases fatal rates of 3.5% since the beginning of the year. These facilities are not just statistics, but a significant loss of loved ones, family members, a spouse, a parent, and often a seasoned healthcare worker and team members. This situation is compounded as the rainy season intensifies. This disclosed that experts who conduct the risk assessment last week placed Nigeria in high risk of increased risks of cholera transmission and impact. Yeah, so on that note, on today's edition, now we'll be discussing and diving in deep on the preventive measures we need to take locally in our homes, in our schools, in our work environments to help prevent cholera. On today's edition, I'm not alone, and I have a pharmacist here with me who can help us throw more light on preventive measures. Her name is Midday. Midday, you're looking so good. Thank you so much for joining us on today's edition. How are you doing? How's the day been?
I'm good. Okay. How are you doing?
I'm very well. Thank you for asking. So it's just devastating to get this statistic report saying 53 persons have already passed from over 1,000 cases that we have, and it's just because of the intensity of the raining period. But on that note now, there are a lot of measures that needs to be taken, right? And what do you think, basically now, a layman sitting at home now, what do you think is the basic steps he needs to take to help, prevent himself and families from getting, infected?
Okay, thank you very much. Just like you said, it's quite a pity that it's almost seeming like a pandemic that has happened this period. Many cases in Lagos State, and if nothing is done, this would spread, and then a lot of people would be affected. So in that regard, it is very important to do meetings such as this, where the public is being enlightened on what to do. So in the case of cholera, basically it's to ensure that there is good hygiene practices amongst people, because it's an infection that is being transmitted from contaminated food when it comes in contact with someone who has been infected with cholera. So when there is a cross contamination between food and then fecal matter, that's when it comes to play. So when individuals are being careful, proper sanitation, ensuring that their hands are washed, and then ensuring that their meals are properly cooked as well, that would really help to curb.
Okay. You made mentions of cook and then the food. You made mentions of someone being infected. Yeah. So now, what role now do our hands play? Because most of the times, like it says, like most deaths hide in our nail fingers. Yeah. So how can we, curtail that?
Yes. So ensuring that hands are properly washed. So after using the toilets, ensure. Even for kids, because kids are the most susceptible population in this case of cholera. Ensure that the kids are trained, wash your hands after using the toilet, and also ensure that the meals, which is very important, before cooking, ensuring that the hands are properly washed, ensuring that safe, the water that we drink yes. They are safe. Yeah, so that would, to a large extent, help curb what's going on.
Okay. What about, you made mention of food. We just talked about hands now. You made mention of washing hands and then, following up with kids, because most of the time they just use the restroom and they end up now probably, washing their hands. So what about food now? Those selling food, roadside food and all. How does the government or NCDC now come in making sure that the environment is all clean? And
that's a very important one. So for this period, people are even advised to try and prepare their meals themselves at home. That way you'll be able to ascertain the extent to which you're observing personal hygiene. Yes. So for this period, in fact, it is something that is advised in general, because there are a lot of germs flying around. You can't really say with other people. People might not be so careful. So the government could do some regulatory measures. There should be some form of regulatory bodies around I don't know how sustainable that will be in Nigeria, but that's something that we could really look into to ensure that the environment of most of these food vendors are ascertained fit enough to cook meals for people.
Okay, now let's look at schools now, because most of the times parents are off work, then children are in school. So now, what role now that is the nursery, primary, and secondary school, even the tertiary institutions, what role now can they play? What measures should they take? What should they provide in their facilities to help, have a serene and clean environment?
Okay, so it's very important that for schools, especially not just schools in general, should be provided with flowing water.
That's public areas now.
Public areas, exactly, should be provided with flowing water and soap, so people can wash their hands regularly, because most times we pick germs. Germs are all around us. So if that can be imbibed, it will really help. And then for schools, there should be like a first aid readily available. A very prominent clinical symptom in cholera is dehydration. So there's a lot of stooling, vomiting. So schools should have, there are sick bays. Most of them have sick bays. And then there should be a first aid system made available, such that before maybe it's being reported to the hospital, they've been able to, give oral rehydration therapy to the kids.
Okay. You made mention of therapy. So, before we get into therapy, so what are the early stages? What are the first symptoms that if one has been infected with cholera right now, what is like the first symptoms? What's the first thing is going to notice? Is it fever? Is it headache? Is it stooling? What is it?
Okay, so a person just maybe drinks water or just purchases a meal from a local vendor, and he starts feeling stomach ache, and then goes to the toilet, and maybe you want to ignore it, but then it continues, and then there's vomiting as well. So at that point, most times a clinical symptom is that the stool has this whitish fluid accompanied with it. It's clear. It's called like rice water.
Okay.
So it's clear. So that's a clinical symptom of cholera, and because of the extent to which fluid is lost through stooling, there is rehydration. So you might experience severe thirst, and urine output too might be really low. These are some classical symptoms of cholera.
Okay, so talking about symptoms now, so what are the preventive measures that one needs to take? Okay,
just like I said, cholera is an infection
that's when you start noticing maybe you've eaten the food, now you're stooling. So what locally, if you just probably started feeling this in the middle of the night, so what can you salvage from your house to use and help yourself get better before morning, before you escalate to something that the individual wouldn't be able to handle?
Okay, so in that case, the most prominent symptom is loss of fluid. So the first focus should be replenishing lost fluid, lost electrolytes. So that's where ORS comes in. So ORS is readily available.
So that's one of the basic things you should. That one should always have ORS in your
Yes,
homes.
and it could be prepared with salt and sugar in water. Yes, and then you could also take over-the-counter loperamide to help with the stooling, and it's very important to report, especially in this time when it's already an outbreak.
The NCDC said it's due to the raining season. So is it that obviously it's airborne, right? Cholera, if waterborne.
It's waterborne.
It's waterborne. So since it's waterborne and then water moves around, so obviously it's going to also go along with the air. So what can be done now, in apartments now? How do what do you do to always keep your apartment safe and secure from all of this?
So sewage disposal system, it should be reviewed. At this time, it should be taken into account, and proper sewage disposal system is very important this period, and also taking safe water, bottled water, ensuring that whatever water, maybe boiling in case of people who cannot afford bottled water or sachet water, it could be boiled and taken, and then also ensuring that your meals are properly cooked. That's also very important. People should try as much as possible to cook their meals themselves at home, and ensuring that they are well cooked. And also when handling fruits, the fruits should be, avoid fruits that are exposed already. People sell around in nylons, they're not very safe. So you should want to go for fruits that you peel yourself. And then,
you made mention of running water. So, for example, you get to a public space and there's a water in a bucket or stuff. Is it safe to use to wash your hands with probably the soap before getting to a public place, or must it be running water?
It has to be running water, actually.
Why?
Because in a bowl, you're washing your hands, you're taking out the germs, and you're still taking the germs back into your hands. Do you understand? So you're washing, it's there and then, so it just has to be. You could get someone to pour water over your hands.
Even if it's in a bowl, just get someone fresh and then you just wash it out.
Exactly. And ensure that the water being used is clean water too.
We are still having a conversation. I'll sorry to cut it short. We'll just go on a very quick break, and then when we come back, this conversation is getting interesting, and then Midday Discourse continues. Please do stay with us. We'll be right back.
for an insightful idea that takes the center stage and the conversation that gets beyond the headlines, to explore the lasting impact of political decisions. Big Talk got you covered. From policy debates to geopolitical insights, from thought-provoking discussions to actionable insight.
What is the real responsibility of government?
Big Talk delves deep into the heart of the matter. Join us weekdays on global televisions from 6:30 p.m. for a reverting journey into the heart of politics, where we dissect issues shaping our society.
With every government and introduction of new policies, businesses of all kinds and sizes seize the opportunity to evolve and redefine themselves. Business Point on global television is where we follow the money and put the facts and figures right in front of you. Watch Business Point every Monday through Friday at 11 a.m. as Kikelamo Okeri tracks all the latest developments across critical sectors. Business Point, this is business.
Are you ready to be entertained like never before? Get ready to dive into the latest and greatest entertainment news in lifestyle, music, movies, birthday celebration, and so much more, all on Entertainment Circle on global television. From the hottest red carpet event to exclusive interviews with your favorite stars, we've got you covered. Stay up to date with the latest trends and news from the entertainment world, all in one place. Tune in every Saturday by 1 p.m. with Chung Annabelle Joseph on global television.
In an ever-busy world, the increasing challenge of keeping track of health matters can be extremely demanding. Follow the latest health tips and trends on Health Guide on Global Television on Tuesday at 3 p.m. Health Guide on Global Television. Put your health first.
Many thanks for staying with us on today's edition. Thank you so much for joining us. So this conversation is getting interesting, and off the camera we had something interesting that I want to bring to you. And you know, we were making mention of NCDC and measures they should set to help create more awareness. So what do you think the NCDC should do now so we wouldn't have a fire brigade approach when we have a whole lot of cases?
Okay. So something that could really help, like the conversation that's going on right now is public awareness, So I don't know if that is done enough this period, but there has to be a lot, like it cannot be overemphasized. The level to which we need to do public education on
affected, and it's going to be really devastating. They might just think it's just food poisoning or something. So
yes.
Do you think the NCDC should go on a
so
school tour to educate people more?
Yeah, so that's the reason for
get deep into the conversation. Let's go on a very, very quick break. My producer says we'll be right back. Yes, sorry for that quick technical break, but we're back. So, Bethel, you were trying to get deep about the measures that NCDC should take.
Okay, yes. I was trying to say that it's very important to do public health education. It's very important. Just like what we're doing now, if we could go all out on social media platforms so that everybody is aware of it. So prior to now, if one would ignore the symptom, their minds would go to, okay, you know, this is going on and I might need to be careful, I might need to look in more, I might need to observe. Like I said, the physics in cholera, it has this white substance accompanied by it. That's a classical symptom. It's something that people might want to look out for. And then when there is, especially after a meal. Yeah.
Especially after a meal. So for those of you that eat anyhow, just cut it out this period and, you know, watch out what you eat. So, you know, most of the people that have been affected or those that lost lives are actually coming from the rural areas. That's the local government. You know, there are a whole lot of challenges in those areas. Aside, apart insecurity is there, bad road network, low on electricity, low on health care, and low, very, very low on water and education. So, what does the health sector and NCDC, including the government now, what do they need to do to like improve all of this?
Okay, something that would really help is ensuring that people in the rural areas are being provided with safe drinking water. It's made available because that's one way through which cholera could be contracted. Ensuring that the water made available to them are safe, and then people to also boil their water, ensure that it's boiled up to 100 degrees and then cooled before being ingested. Foods to be prepared by themselves at home, and also like a surveillance system that would say that would be able to, you know, report a case where it's not being handled, so that, I mean, the earlier the better. So when it's being reported to the right healthcare professionals, they'll be able to curb whatever it is. Yeah. And something else that could help, I mean, these rural areas, for them to be well equipped with, I mean, over this ORS, intravenous fluid, because it's very important. Yes. So there's no case of someone arriving at the hospital and then these basic things are not made available. So yes, that will be really important.
You know, there was this, I think, a little bit, I think around 2012, 2013, when the outbreak was superb. I could remember people having their baths with warm water and salt. Yes, I can remember people having. Is that a measure that one needs to take in preventing it?
Not at all.
Okay.
Yeah, fruits could be washed with salt. Salt is a good antibacterial agent. So fruits could be washed with salt, but you don't need to have a bath with salt. That was actually a wrong approach.
You know, that's why we have you who it's more in the medical line to, you know, educate the public and let them know that, okay, all of those approaches are really not the way to go. Okay, you know, we're still looking at NCDC because they have the major role to play, because we wouldn't want to have, you know, the same incident. We pray not to have the same incident like COVID, you know, that it's hard to force everybody to stay home. So, you know, I'm still always going to come back to NCDC because this is all about disease outbreak and all. So you made mention of creating awareness. What do workshops come in, and maybe even for those in cities, because most of the times we are all either busy at work or catching up with a meeting or an appointment. So what should be done now by, you know, for those in the cities, let's say urban areas now?
Urban areas. Like I said earlier, public places to be provided with running water and soap, so people wash their hands regularly, and also using an alcohol-based hand sanitizer. I mean, that's something that we all should have in our bags, you know, to apply every now and then to ensure that your hands are being sanitized.
Okay, so it just, let's say maybe one didn't get to discover on time or get to feel it's just normal food poisoning and doesn't know that is that he or she has contacted cholera, what are the measures? Should you confide yourself? Should you quarantine yourself, or you just go about your business?
First step is to hydrate. It's very important because the dehydration happens so fast. So hydrate and please report to your nearest hospital. Okay.
That means reporting obviously needs to take you out of your premises, and then that means you need to be quarantined, right? That means one will need to be quarantined if that should be the case.
Yes. Okay. Yes, you could say so.
Okay, so looking at these angles now, basically, cholera is just something that is breaking out, and in 36 states now we've recorded 53 deaths and over 1,000 suspected cases. Okay, so what can be done now to for this not to escalate? Because this was how COVID started. Gradually, the numbers kept increasing. So how do we make sure these numbers now does not increase?
Okay. So the first thing would be to suspected cases should be reported. Okay. This shouldn't be treated with laxity. Should be reported to the nearest hospital. Okay. And then measures, I would always say taking measures, because if everybody is educated and aware, it would, to a large extent, curb it from escalating. So everybody does their part, ensures their meals are cooked, ensures that they're washing their hands properly, and then they're also educating other people too.
Okay, let's go on another very quick break, and then when we come back, Midday Discourse continues. Please do stay with us.
Get ready for it. Inside Today brings you issues relating to family, peer pressure, drugs, substance abuse, societal and topical issues making rounds. Join Juma and Manson on Global Television Monday to Thursday, and they repeat every Friday. Time 2 p.m. to 3 p.m. Don't miss out.
Are you a food lover? Do you care about your health and nutrition? Are you interested in exploring the diverse culinary traditions from around the world? Then look no further. Introducing Lunch Global on Global Television, a show that takes you on a delicious journey through the world of food, nutrition, and diet. So, whether you're a seasoned foodie, a health enthusiast, or simply curious about the world of food, Lunch Global has something for everyone. Tune in Mondays to Fridays and let your taste bud take you on a journey of flavor, culture, and discovery on Lunch Global. Bon appetit!
Time check. It's midday. Then it's Midday Discourse. Midday Discourse is a program that covers trending local and international news, current issues, and human-related topics. Join Samuel Odi weekdays 1 p.m. on Global Television. The discussion starts here.
Get a shot in.
Many thanks for staying with us, and let's continue this conversation. Let's look at the health sector now. Do you think the health sector are doing enough in terms of providing adequate healthcare services or maybe facilities rather for these rural areas to be able to have basic medical facility, basic medical outreaches?
Okay. I feel like the health sector is doing what they're supposed to do, but a lot more can be done to, improve. A lot more can be done to improve, definitely.
Okay, majorly in the rural communities.
In the rural communities, ensuring that the budget is appropriately utilized to ensure that the basics are made available for them.
Okay, because like they always say, health is wealth. So we all need to take preventive measures to make sure all of these things happen. But let's look at vaccination. Can one take vaccinations?
Oh yes, vaccines are made available. It could provide temporal prevention. Against cholera.
Okay, that means it's not like the ultimate goal. The moment you take it, you have Odeshi. That's I'm like, okay, Odeshi. Okay, there's no how you will get infected. Okay, looking at prescriptions now. You are a pharmacist, and I know this is going to be very, very important for the people to know. Is self-medication allowed when, apart from taking you said ORS?
Yes.
Aside that, which is approved worldwide, that one can just have a portion of salt, sugar and water and then mix together to drink. But does self-medication help in situations like this? Maybe probably someone deciding to take antibiotics.
Yes. So antibiotics are a treatment that's recommended for cholera, but then antibiotics are not made over the counter.
Okay.
That's why I was not putting so much emphasis on it. So yes, that's why I said it's necessary for them to report to the hospital. Yes, there are antibiotics that are actually used in the treatment of cholera. First thing, to ensure that hydration, very important. Ensure that, I think for this period, people should actually have it in their first aid boxes at home. Have ORS sachets mixed in a liter of water, and then take. And antibiotics, so I don't want to delve into talking about what antibiotics to take for it. Yeah,
okay. True, we wouldn't want to encourage people to just decide not to self-medicate and not go report cases because basically we feel it's broader and deeper, because you might just feel like, just like people, sometimes I'm guilty of doing that. If I have a headache, I'll just feel it's just headache without knowing it's probably typhoid or malaria and all of that. But looking at self-medication now, is it permitted at all? When you just notice the symptoms of cholera, is it permitted at all to, aside taking ORS, is it permitted at all to take any other pill, probably paracetamol, which is the basic? And does cholera come with high fever?
Yes, fever could be experienced, and yes, there's also this sunken eyes because of there's dehydration. There's dehydration. Then the hands could be really wrinkled too as a result of dehydration. You see why there's a lot of emphasis on rehydration. Yes.
Okay. All right. Thank you so much, Beto, for joining us today on today's edition.
Thank you for having me.
And like Shuri rightly said, you have to always hydrate, and don't do self-medication aside taking ORS. And on today's edition, and this is how much time would permit us to take on today's edition. But before we say goodbye to the general public, what is your final take for the NCDC and the health sector, that is Ministry of Health now, and then the public, on what to do in helping prevent this?
Okay, so the NCDC to foster public health, foster promotion of education, public education about cholera prevention, treatment, first aid, like we earlier mentioned. Yeah, and also for the rural areas to ensure that they are being provided with good water. And
good running water.
Good running water. And also a surveillance system that allows for quick reports.
Okay.
So if there is a suspected case, before it gets, before it escalates, you know,
yes.
it's being managed. And very importantly, for the healthcare systems to have in place what is necessary, what is needed to manage the situation.
Okay.
So it's for them to be fully equipped, for them to have the medications needed readily available, to ensure that people who come down with this infection are being properly managed.
Okay, let's let me ask you one quick question before we run off. If, for example, now let's say in this studio someone gets infected, should the studio be, you know, locked and then shut down, and maybe what should be done? Can people still come in freely and, you know, go about their businesses, or the place should just be avoided for some time?
Okay, so cholera is not transmitted person to person.
Okay, it's not like COVID.
It's not like COVID. Yes, it's not. It's transmitted when there is contact with food or drinking water.
Okay.
So the thing that should be put in place is for people to be aware. You don't necessarily need to lock up the place, but people are aware. So, I mean, everyone is armed with sanitizer, everyone is conscious, protecting themselves, and so protecting others as well.
So aside dirt now, aside water now, so does debris now contribute to one having cholera?
Yes, that's why improper sewage disposal system could also, basically when food gets in contact with food or water, anything that is being ingested gets in food, fruits, water, whatever is being ingested, once there is a contact with this bacteria, it could be contaminated and one
then
could
it gets
come
into your body. Okay. Thank you so much, Betta, for joining us on today's edition.
Thank you for having me.
Yes, so we've all heard it from the pharmacist who has broken it down for us and said, one, you need to always wash your hands, and you can wash your fruits. That's the ones that you won't peel off. You can wash it with salt, and do not beat with salt and warm water. It's a no-no. It's not going to, you know, change anything. There is also vaccination. Vaccination, it's not an odishi that when you take it, you wouldn't get infected. It's just something that you would need to, you know, subdue, and then that would help your immune system fight the infection. So looking at those angles now, like they say, health is wealth. When you notice something, pay very key attention to what you eat. Don't have this mentality of, whatever I eat is going to boost my immune system. And for all of us that get all spiritual and say we wouldn't contact it in the name of whatever God you believe, we should pay attention to hygiene, self-hygiene, make sure your environment is clean, and always sanitize your hand, wash your hands, watch your food, and as well, just have a very, very clean environment. If you used to have a dirty environment, now is not the time to have a dirty environment. You should
always have a clean.
You should always have a clean environment, not just clean environment, clean clothes, clean nails, cut your nails, and always hydrate. If you notice, she kept emphasizing on hydration, hydration, hydration. So you have to always hydrate so you stay healthy. And if you notice that your tummy is a bit rumbling, don't say, I'll just take, what's that called again? Flagyl, and then I'll be fine. Just, okay.
Don't self-medicate.
Don't self-medicate, yes. Don't self-medicate. And that's how much we will be bringing you today on today's edition. And my name is Samuel Odi, and Midday Bethel. Thank you so much for joining us on short notice. I would love to have you here again, and you have a great day. And then you all have a great day. Like they say, health is wealth. Pay key attention to your health, and parents, always take care of what you cook for your children. And for those of you eating roadside food, I think this is not the right time to be doing that. You have a great day ahead. always hydrate yourself. I'll see you again tomorrow for another edition of Midday Discourse. Good afternoon. I am Samuel Odi.